So this organization, between 200 and 300 bed hospital, urban, I took over in the middle of writing for them. And this was not their first time around. So with us, they've engaged us multiple times with multiple of their hospitals in their system. But this one in particular was unique because again, they had some challenges. And their MPD departed and she kind of left them with a mess. They had documents stored all over the place. So they had a really big challenge trying to find what she was working on and try and get back into it. So basically they they hadn't replaced the MPD yet. So they had given the task of completing the documents to one of their directors. Again, somebody who wrote for Magnet, but had not led it. So she had to go through that crash course of learning how to manage the whole thing. They did have another MPD from one of their sister organizations come in and to support her, but she really was the person that did everything. And not only did they have the loss of their MPD, but they also somewhat turned over their CNO. Their CNO that they had for the organization moved to system. And so he became the systems CNO for all of the hospitals. So they had a new CNO for the organization. Having both at the same time really was difficult. Again, teamwork is really what we have to do to partner with these folks to try to assist them and get them where they need to be. Ending up with really 11 exemplars, they did fantastic. They also went straight to site visit. They had just 3 deficiencies going into site visit, which is a feat in itself, truly, after the rat race that we went through to get everything accomplished and written for them. Just a testament to our teamwork and how some of my colleagues helped to do some of the editing to get them done, and then our QA process. So at the end, we always do a QA of the documents and catch things. One of their exemplars, really a fantastic story, sad story, but really a testament to how much their leadership advocates for their staff. TL5A is about the CNO advocating for well-being. And they had a situation where nurses were injured by somebody as they were trying to treat. They were outside of the emergency department, and they were trying to treat someone who came in. So the CNO advocated for their health and safety in ensuring that they had 24/7 security to take care, to watch over them and make sure that they're safe. They have sustained their bachelor degrees. So they're nurses that hold a bachelor degree or higher in nursing at 98%. So 98% of their nurses have a bachelor's degree or higher. Fantastic. And then another one, just really about their demographic, is their outreach, their community outreach. They have a council that does work that is just phenomenal to help their community because they have so many people that are needing support and help to try to just to live. And then, of course, all of their NSIs, falls with injury, ambulatory patient burns, and patient falls, along with chemotherapy extravasation rates. All of their units outperform 100% of them. So having both inpatient and ambulatory falls with injury, 100% of their units in both areas outperforming the benchmark 100%, the majority of the time, that is huge. And that's a difficult feat to undertake. And then they had a couple of their inpatient patient satisfaction metrics that outperform, the 100% of their units outperformed in that patient education and safety. And then their final exemplar was in innovation. They are the only level 1 trauma center in the region, and they had established a 6-year partnership with the U.S. Navy to advance readiness for trauma and potential major catastrophic trauma in an area during peacetime. So they created this partnership, and that was a really cool story as well. So some really awesome things that they do.